Thank you for joining us today for another edition of Conversations with AARP. I'm Troy Deshabert Schuster, State Director for AARP in the Virgin Islands. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 years of age and older to choose how they live as they age. With a nationwide presence, AARP strengthens communities and advocates for what matters most to the more than 100 million Americans aged 50 and older and their families. For more than 60 years, AARP has been working to ensure a high quality of life for all Americans as they age. One of the key priorities for AARP focuses on advocating for better health for all Americans. Most importantly, people should have access to affordable, high quality care through the course of their lives without regard to their wealth or location. While personal behaviors may affect longevity, they are not the sole determinants of healthy living and aging. Access to affordable, high quality clinical services and medical care is crucial. Research has shown that access to quality care is a top concern for many Virgin Islanders. Nearly half of the respondents in a recent survey conducted by AARP VI identified healthcare reform as the issue of greatest concern, and the majority of respondents think that it is the most important issue for healthcare and elected leaders in the Virgin Islands to address. That is why we have invited healthcare leaders from the Schneider Regional Hospital and Medical Center to join us today. We are pleased to welcome Attorney Tina Comissiong, the Chief Executive Officer, and Dr. George Rosenberg, Acting Chief Medical Officer, both from Schneider Regional Medical Center, to discuss how the hospital is leading the way in driving change within the healthcare system to better support residents of the Virgin Islands. We're eager to hear of the practices and policies they have implemented to help our community navigate the complex care system. Again, Attorney Comissiong and Dr. Rosenberg, thank you for joining us today.
Thank you for having us.
Thank you so much for having us. It's a pleasure to be on your show.
A pleasure. And so we often hear from the CEO of our hospitals. So I'm not going to ask you, Attorney Comissiong, what you do as a CEO. We all know that. But we don't often hear from the Chief Medical Officer. So Dr. Rosenberg, tell us what you do in your capacity as the Acting Chief Medical Officer of Schneider Regional.
Okay. As a CMO at Schneider, my primary responsibility is oversight of the medical staff and the healthcare that's delivered to our patients. Additionally, an important part of my job is to recruit the necessary staff we need, the physicians and specialists that we need to staff Schneider and provide the care that our community needs and deserves, as well as to initiate new lines of service that are lacking in our community so that patients can receive high quality health care right on island and don't have to travel abroad to get it.
That's great, and that's a very important role because if we don't have physicians in these lines of services, then we don't have a hospital nor healthcare. So it sounds like you stand in the heart of what it takes to run the hospital and keep it functioning, fully staffed with physicians. So thank you for the great work that you do there at Schneider Regional. And before becoming the acting chief medical officer, you practiced radiology.
Right. I was the chief of radiology at the hospital and had my own private imaging center for 38 years. So I'm an old hand at this.
And so as we were discussing earlier, the hospital dragged you out of retirement and brought you back.
They didn't have to drag me. I was so bored in retirement. I was overjoyed when CEO Comissiong offered me the opportunity, and I'll be forever grateful to her for that.
Well, that's wonderful. And, speaking with healthcare leaders, providers, being active, staying at work, keeping your mind sharp is so important to ward off dementia. So, yeah, it's great that you're exercising your mind and your skills and there at Schneider Regional. And
Yeah.
so I want to be like you when I grow up. I don't ever
Right.
want to retire.
I don't recommend it, not for me anyway.
Exactly. Very good. And so, Attorney Comissiong, CEO Comissiong, tell us a little bit of what your vision was and is for the hospital as you assumed this role of CEO.
Sure, thank you. So it's been really, really wonderful working with such an amazing team of leaders and clinicians and staff members at Schneider Regional since assuming the role as Chief Executive Officer. And I really have a committed team working with me to help us to make healthcare in the St. Thomas St. John district even better and to make our hospital even greater than it is right now. We provide a wide range of specialties to the people of the Virgin Islands, all the emergency care you may need, as long as a lot of specialty and secondary care. And we want to even expand that. We want to expand what we're doing. We want to offer more services right here at home so we can cut down on the number of transfers and people that have to leave island for care. And we're really, really appreciative and grateful for the contributions that Dr. Rosenberg is making in his role as the acting chief medical officer and helping us to recruit some of those specialists and helping us expand some of those service lines. Two of the service lines that we're actively working on right now that we're very, very excited about are gastroenterology, which is very much needed in our district, and interventional cardiology. We hope that your audience that's listening will be very excited and will choose to come to Schneider Regional for this care. We have a heart and lung center where we provide cardiology outpatient clinic visits, and we'll be expanding the providers working there. We have Dr. Leroy Sterling currently on staff, and he's doing a great job taking care of our cardiology needs. And we'll be adding a very talented interventional cardiologist who will not only be able to do clinic visits, but will also be able to do very important procedures and to take care of patients who present to the hospital having a heart attack. We'll be able to put in stents and to do interventions right here at our hospital. And we're very, very excited about that. So there's a lot happening at Schneider Regional that's really positive, that we're really excited about. In addition to adding service lines, we're really working on the overall financial performance of the hospital, increasing our revenues, decreasing our expenses, and just making the hospital sustainable into the future.
Wow, you said a lot in a very short period. Now let's try to unpack some of that. So over to Dr. Rosenberg, as Attorney Comissiong mentioned, a couple of new recruits of gastroenterologists and interventional cardiologists. So Dr. Rosenberg, tell us about those two recruits, starting off with interventional cardiology. And for our audience, tell us exactly what an interventional cardiologist does in contrast to a cardiologist who's not interventional.
A non-interventional cardiologist can treat many cardiac issues. What they can't do is when a patient is having a heart attack or needs an intervention to open up a blocked blood vessel and put in a balloon to open it up and a stent to keep it open. That regular cardiologists do not do. That you have to have additional training after your fellowship, after you do a residency in internal medicine, a fellowship in cardiology. You have to do another one in interventional cardiology. Dr. Richard Zellman, who is the cardiologist who is joining us in the next couple of months, is an extremely experienced interventional cardiologist that has expertise in all areas of cardiac interventions, including what's called structural work, which means that he can go in and actually replace your cardiac valves percutaneously without having to. And when I was in training, you had your chest opened up to have that done. No longer. In many instances, it's care that needs to be given immediately. So traveling off island, although you may get the care, you're at risk of having heart damage. So the sooner you can get it, the better. And Dr. Zellman is literally at the top of the field nationally and will be able to provide all those services additional to putting in pacemakers and defibrillators and all other procedures, as well as he's fellowship trained in doing peripheral vascular work. So there's a problem with blood flow to the kidneys or to your lower limbs. He can go in and treat those as well. he's a multi-talented clinician.
Wonderful. That's great to hear, and it's so very important because cardiac disease is so very, very prevalent here in the Virgin Islands and one of the
Right.
top killers here in the territory as well. And what about in looking into the future, the possibility of bringing in a cardiothoracic surgeon to do open heart procedures and so forth?
I personally have not looked that far in advance. That requires a whole additional team of experts, and the prediction of success in those settings, I think, is statistically linked to centers that do large volumes. With our population size, I don't think we can ever attain the volumes necessary to maintain expertise. Not with the surgeon, okay? I mean, the surgeon could come in and do, it's rare that it's an emergent cardiac surgery. But also the ancillary, the nursing care, the cardiac care unit,
Yes.
cardiac rehab, it's a big deal. And I don't know that cardiac surgery is an appropriate line for us to be pursuing. We have more crucial lines that we will have a greater impact on our population.
Yeah.
And with a superb interventional cardiologist, the need for surgery will be that much less. When
Right.
we can
Yeah.
treat the acute presenting patient with a percutaneous intervention by an interventional cardiologist, relatively few will need surgery.
Right. Yeah. Point well taken. Point well taken. Yes. And our small population size does make it difficult to sustain
Right.
cardiac surgery, definitely. And so tell us about the gastroenterologist that
Yeah,
you
we're
have
very,
recruited.
very excited about that. We've been without a full-time gastroenterologist in St. Thomas since the hurricanes. At that time, we had Dr. Lawrence Goldman, who is one of the finest physicians I've ever worked with, a superb gastroenterologist. His home was destroyed after the hurricanes, and he and his wife left. Well, he's coming back. And additionally, we recruited a Dr. Aram, and they're going to split the position. They'll be here 2 weeks apiece each month. Dr. Goldman is well known to our community and beloved in our community. Dr. Aram is a superb, I know people who've worked with her in the States. She's a superb gastroenterologist, did all her training at Johns Hopkins. In the medical community, that's very rare air. That's very elite. And she's a delightful person and a superb physician. So we will have top-notch gastroenterology here in a month's time. So it's happening as we speak. We're putting all the things in place. We are opening a gastroenterology office in Schneider Regional where they'll be able to see patients for any gastrointestinal problems or liver problems or pancreatic, anything GI specialists deal with, as well as they'll have their endoscopy suite adjacent to them and be able to do all of those procedures right on the spot. So we're very excited about that.
Oh, this is fantastic news. You're almost making me want to move back to St. Thomas. I used to live there, but I came back home to St. Croix with all the great medical services. It's really, really wonderful to
Well,
hear.
and
Attorney-
just if I could continue, on the CEO Commissiong's direction, we've opened an outpatient psychiatric service, a wellness center in our hospital. We've recruited a number of board-certified psychiatrists to staff our inpatient unit. So we're really upping the stakes for mental health. And we will also be offering those services on St. John. So we really, it's been a long time, if ever, that we've had 3 highly qualified psychiatrists to take care of our population. So
That is so very important because mental health issues really challenge the community in amazing ways. And it's so very sad.
it is.
Most of the people that we see on the street who we just simply consider homeless, they're not homeless for financial reasons. They're homeless because of of behavioral health problems, challenges
Yes.
that they're suffering, you know?
And we have run a homeless clinic in St. Thomas for almost 15 years now. And when we introduced psychiatric care to that population, the changes that occurred to that population were really dramatic. We took people who were literally living on the street and eating garbage to the point where they're now employed, living independently. Just the right medications and the right therapy, you can do wonderful things. And we're going to make tremendous strides in that area at Schneider Regional.
That is absolutely fantastic, fantastic. And so, Attorney Comissiong, tell us again the timeline for these new services coming on. I understand gastroenterology is about a month from now. What about interventional cardiology?
Yeah, gastroenterology is about a month from now. We want to encourage the listening audience to contact us, reach out to us, schedule your colonoscopies. We're able to do routine clinic care and get you scheduled for that very, very important screening test. So that will start in October. And interventional cardiology will also start this fall. We're thinking that we'll have a start of our clinic services in November and be able to actually start doing interventions before the end of the year. So we're very excited. We're introducing new, very high-tech equipment to our existing cardiac cath lab so that when our provider, Dr. Zellman, comes, he has the equipment that he needs to take care of our patients. So a lot of work is being done right now to prepare for the introduction of these two service lines or the expansion of the service lines. And we just look forward to serving the community. We really want to build that trust with the community. We want them to feel comfortable coming here for your care. We know our providers are as good or better than any provider that you will encounter when you go to the States to be seen, at any of those big name hospitals. We trust our providers as much or more than them, but we want the community to do that. And to give us a try, come by. We want to also be prepared if you need us in an emergency. And so that's why we're aligning ourselves with interventional cardiology and trying to get that up and going as quickly as we can.
Yes, it's no secret to the community, but I am a cancer survivor, and when I was looking for an oncologist to treat me, I was about to go to New York to Cornell, and I was going to stay in New York and go through all of my treatment there. And I mean, I had all of it planned out, and then I heard of Dr. Hobdy in St. Thomas, and I said, let me just look at her credentials. And I saw her amazing education. Her training is world class.
Mhm.
And I flew over to St. Thomas, and I had plans to fly from St. Thomas to New York. When I met with Dr. Hobby and spoke with her, I say, you know what? I'm not going anywhere. I canceled all of my New York plans and I stayed right here, did all of my treatment right here in the Virgin Islands between St. Croix and St. Thomas. And I had a great outcome, over 10 years cancer free now and no sign of any return. And it's been proven time and again that when you are treated in your home environment, you have much better outcomes. And I always encourage other Virgin Islanders to consider receiving your health care here in the Virgin Islands. If the service isn't provided, of course, you have to go elsewhere. But as long as the service lines are available, stay home. Make use of our great physicians here, of our hospitals. We have very, very, very dedicated healthcare workers. I know the hospitals are challenged, especially here on St. Croix, but the nurses are so very dedicated. The physicians who are here are very dedicated, and I always encourage people to stay right here at home and receive care. So it's again so refreshing to hear what you're doing at Schneider Regional. But then now I have two questions. Not to put you all on the spot, but two questions that are always the top of people's minds. Number one, about the cancer center in St. Thomas, Charlotte Kimball Cancer Center, and also the clinic in St. John. So I know
Sure.
you have plans for both, so if you can talk to those plans for a moment.
Sure, I'm happy to address both and update the public with where we are on those plans. I actually had a very good meeting today with the executive director of the Territorial Hospital Redevelopment Team, Mr. Darrell Smalls, who's leading the redevelopment efforts along with the administration of the two hospitals and the board. We're really excited to announce progress on CKCI. So the Cancer Institute serves the entire territory. As you know, it's been damaged and closed since Irma and Maria. But we have completed the architectural and engineering design plans for the rebuild of the facility. and we have completed the interior demolition of the facility to prepare now for the reconstruction. We have gone out to bid and received proposals for the reconstruction effort, and decisions are being made right now about that contractor. So very, very soon, we'll be shovels in the ground, getting ready on the reconstruction rebuild of CKCI. And we're looking forward to starting to serve patients again in that building, hopefully, fingers crossed, in the next 18 months. As we know, it takes a while to do the construction, and then there's very highly specialized equipment that goes into the Cancer Institute. We're getting a brand new linear accelerator, which provides that radiation oncology treatment. So it will take a little while to get those items here installed in the building, ready to serve patients again, but we're working very diligently towards it. It's our #1 project, I think, across the territory right now. We've gotten JFL North stood up due to CHRT. Now we really got to get CKCI going so we can get back to providing radiation oncology within the territory.
Great.
In terms of Myrick Heating, also very focused on St. John. We went up and addressed the community in St. John last Friday, Dr. Rosenberg and I, to talk about our plans for improving services on St. John, to include rotating additional providers up as much as we can. On St. John, we're limited somewhat by that facility also being damaged and still being in the temporary trailer that was erected by Army Corps of Engineers immediately after the storm. We're able to still provide clinic visits, family care visits, visits for mothers who are expecting. We do routine clinic care still. There's some laboratory services, some radiology services. And then we're still available 24/7 for any emergencies. We're staffed 24/7, and we have a very good relationship with Fire EMS for transferring patients from Myrick Heating to St. Thomas when that's needed. We do, though, look forward to getting back into the full space of the new Myrick Heating. It's going to require rebuilding the old permanent facility. We've gotten some final determinations from FEMA in terms of the money that would be made available for that project. And so the next steps is really to sit and do the programmatic design, start the architectural and engineering work. For that, we really want the community's input. We've started to gather it already by participating in things like the forum on Friday, but we're going to continue to work with our staff members, our clinicians, our docs, our nurses, and the community to be sure that we are designing the Myrick Heating Smith Center that we want for the future for St. John. So
Excellent.
More to come on St. John. It's a little further out, but we're hopeful for maybe a 2-year window for Myrick Heating.
Wonderful, wonderful. A lot of good work going on. I'm glad to hear of the progress and all of the wonderful plans. And here we are broadcasting live on Facebook and YouTube, and I'm seeing the questions and the comments coming in through Facebook. And so one person said, awesome, very happy to hear of all this going on. And then one person has a question, and that is, how do you go about getting an appointment for a colonoscopy at Schneider Regional?
You call the hospital at 340-776-8311, extension 2400. That number and extension should be up and running, if not already, in the next day or so. And they can make appointments that way.
And we're going to be doing some direct outreach with some primary care providers' offices too. So we'll be sure that we are letting them know about our services. So if you go to your primary care provider, they can certainly refer you to us, and they will have the information to be able to help you book your appointment or directly book the appointment for you. It's something that we are trying to really inform the community about, so that persons who have been waiting to get the service done can get scheduled for it.
Great. And so we have about 3.5 minutes left. So for final thoughts, Dr. Rosenberg, first to you.
I just would like to talk about another line of service that we're surging ahead for, and that's dialysis in the community, where we have also recruited a top-notch nephrologist, an interventional nephrologist, whose mission is to try to introduce home and peritoneal dialysis to our community, so people don't have to come to the hospital for hemodialysis. They can do it in the comfort of their home, or they can do peritoneal dialysis And that's his mission, is to institute that. And the people in St. John won't have to travel to St. Thomas for dialysis. Additionally, we're going to be introducing a fast track in the emergency room to alleviate the backlog and the wait times in the emergency room. So we're surging ahead on all kinds of ways, and it's very exciting for all of us.
Wonderful. Great to hear. And Attorney Comissiong, final thoughts?
Yeah, final thoughts. Just that we have an amazing team and really proud of the work that we're doing to continue to improve the services that Schneider Regional offers. As I always say, all of us live here. It's in our collective best interest to support our hospital. It's any of us could need our services at any time. And so we really appreciate the community's support. And we've relaunched our foundation. So there's the SRMC Foundation. It's a way to give and give back to your community. And you can trust that the funds that you give will be used for a very, very important purpose, really saving lives. And so we want to encourage you to do that and encourage you to continue supporting the hospital and coming to us for your care. And we are committed to improving our services for you.
Great. And do you have a Facebook page or a website that people can access to keep track of all of the improvements?
Sure, we do. We have a very robust website, and it's srmedicalcenter.org. I'm sorry. You can come and see our available positions, our services that we offer. You can connect with a physician through our website. We're working to activate a patient portal where then you'd be able to get your records directly. And we're working to be participating in an HIE where we could transfer your records to another provider for you. So our website is great. We also have a Facebook page. We invite you to check out our Facebook page, get updates on our events. We do a dinner with a doctor event for the community monthly. It's great. We invite you to come and get those tips directly from the clinician and enjoy a nice dinner with us. So stay tuned to new things happening at Schneider Regional.
Wonderful, wonderful. Well, thanks again so much for taking the time to be with me on this show and to inform our audience, to inform the entire Virgin Islands of all of the great work going on at Schneider Regional and the wonderful lines of service being offered. And again, I encourage all of our listeners and viewers to take advantage of the healthcare services provided right here at home in the Virgin Islands. Of course, again, if the lines of service are not available, then you will have to go off island, but check out our physicians, our healthcare here in the Virgin Islands first before you make that decision to leave for healthcare. So thank you both for the great work you're doing, and I continue to encourage and support you all, and we look forward to having you in another show of AARP in the Virgin Islands, Conversations with AARP. Thank you so much.
Thank you.
Thanks for having us.
Okay.
My pleasure.
Bye-bye.
Bye-bye.